Coming up, we are shining a spotlight on men's health.
How regular screenings and early detection can make all the difference in saving lives. After the break. In today's Health Smart, we are talking about Men's Health Awareness Month.
And when it comes to screenings and cancer prevention, it can be hard to know exactly where to begin. Joining us now to clear up the confusion, Dr. Patrick Alore. He is the medical director of Radnet. Thanks for coming in.
Thank you for having me.
So first thing let's talk about is prostate cancer.
So prostate cancer is the most common cancer amongst men, affecting 1 in 7 men, and actually about 80% of men at the age of 80 will have prostate cancer. So it's important for men to know the symptoms of prostate cancer, such as blood in the urine, difficulty urinating, back pain, lower pelvis pain, and to understand that they need to speak to their doctor about these symptoms. Their doctor would do a digital rectal examination, which I know is not pleasant, but it's still necessary for the diagnosis. Screening of the blood for serum PSA levels, which is a marker that's elevated in the blood when a patient has prostate cancer. The patient would then get a biopsy and perhaps a prostate MRI to help evaluate the staging of the disease and potential treatment.
Isn't it really great to catch this early, specifically prostate cancer?
That's correct, because it's very treatable. There's multiple ways to treat it, with chemotherapy, with hormonal drugs, with surgery, with radiation.
All right, and let's also talk about colonoscopy, another unpleasant thing for a lot of people, but very necessary. And my question is, does it need to happen at 50?
Correct. So it should happen at 50. But instead of a traditional colonoscopy, there's another solution to screening for colon cancer, and that would be virtual colonoscopy or CT colonography. And basically, unlike traditional colonoscopy, which is when a scope or camera is inserted into the rectum through the colon, virtual colonoscopy uses hundreds of CT images to create a reconstruction of the colon and do a virtual fly-through of the colon to find small polyps. There are benefits. The one benefit is the patient doesn't have to be put to sleep for virtual colonoscopy, and the turnaround time is much quicker because the patient, can walk right out of the center, doesn't have to come out of sedation. Also, unlike traditional colonoscopy, you're taking a picture of the whole abdomen and pelvis, so you can evaluate all the organs, not just the colon. The downside is that if you do find a polyp, you're going to have that traditional colonoscopy anyway to get the biopsy.
Okay. Heart health, that's also a big issue, well, for men and women, but I think especially for men, right?
That's correct. I mean, heart disease has always been a problem in our nation, but the most important thing to do is to show up to your annual physical examination and make sure your doctor is testing your blood pressure, your cholesterol, your blood sugar levels to test for diabetes. Those 3 things really increase your risk for heart disease if they're not under control. If they are abnormal, there are some screening tests that you can have to help evaluate your risk for heart disease even further, such as CT coronary angiography, a CT calcium scoring, or a cardiac stress test.
And why are we asking about lung cancer specifically?
So lung cancer is actually one of my favorite topics for men. It is the second most common cause of cancer amongst men, and 80% of those cancers are caused by smoking. So in the high-risk population, smokers essentially, which we still have a lot of smokers in the US, it is important to screen for lung cancer with CT. We use a low-dose CT, meaning low radiation dose. We scan the lungs to look for lung nodules, and if we find a lung nodule, we're suspicious that it might be cancer, and we can treat it early, diagnose it early, and the outcome is much better for the patient. The patients that are basically long-term smokers who are between the ages of 55 and 80, and who are currently smoking or former smokers all qualify for this study, and insurance pays for it now.
Oh, that's great. And you mentioned it was the second deadliest. What's the first?
The first deadliest is prostate, or the first most common, I should say.
Most common, right. Prostate, interesting. Okay.
All right, good information. Thanks for coming in.
Thank you.
All right, for more information on anything that we talked about today, you can head to radnet.com.
Thank you again.
Thank you.
Appreciate it.